Today we are going to do tracheal suction on Mr. Jones. So make sure you walk into your patient's room and you identify your patient with two identifiers. That would be with his name band, and also you're going to check the order to make sure it is written for Mr. Jones. Then you can explain the procedure without going into too much detail. You're going to make sure you gather all your supplies and have everything ready, which includes a suction kit, your sterile gloves, normal saline, sterile towel, all your equipment that is needed for suctioning. You're going to have your goggles on. You may wear a mask and gown if necessary. Make sure your ambu bag is at 15 liters, 100% O2. Now, before you open up your sterile gloves, you're going to open up your hydrogen peroxide. You're going to lip it, which means pour in the trash.
If it's been opened.
It's open.
If it hasn't been opened, you can open your top and you have to date it. Your lid is going to go face up so that you can use that lid again. I'm putting a pair of gloves on because I'm going to give him some oxygen before we start. So you make sure your oxygen is on high. You're going to take off your mask, maybe. You're going to connect it to your patient, make sure everything's in. Take this off. I already let him know that I'm going to suction him and giving him a little bit of extra oxygen. You connect that to his trach. You do 3 breaths before, just to get their oxygen level up to an optimum level.
Keep an eye on his pulse ox before you're doing it, as you're doing it, and after you're doing it.
And I have my gloves on now just to protect myself while getting everything ready. I'm going to have my suctioning tubing ready to go. Turn on my suctioning machine. My water's ready, my peroxide's ready, and now I'm ready to open up my kit. And I washed my hands too. And provided privacy. So this kit is sterile inside. So when you have your sterile kit, remember you want to open everything away from you using the corners. Inside of your kit, you have your little container that you put your saline in. You're going to pop this open. You can do this without your sterile gloves on as long as you don't touch inside of this, because this is where your saline is going to go. And you pop this open so it can hold your saline and peroxide. You're going to open from the corners. Put on your sterile gloves. Remember, dirty goes on the inside. I have my sterile glove on one hand. While I still have a dirty hand, I'm going to dump this. If you put your sterile gloves on and you forget to pour your normal saline, then you're just going to use your non-dominant hand to pour, and then this is going to be contaminated. Then put both of your sterile gloves on. You're going to grab your suction tubing with your sterile hand. This is a long coil, so pull it out slowly. If it comes out and bumps something, you're going to need a backup. I would bring a backup kit in with you, so in case it does get contaminated. Now just use your clean hand to use this.
Connect it. You're going to lubricate it with some normal saline.
When you cover this is your trigger. It pulls, and this is your suctioning. So on your way down, you do not want to cover this, just on your way up.
You're going to use intermittent suction, and you're going to use a swirling motion while withdrawing with the suction catheter, and you're going to rotate it around to help get up the thickness of it.
And I would have let him know, Mr. Jones, we're going to suction you now. And you're going to eyeball it from his nose to his sternum and go about that distance down. If you have mucus in there, you're going to hold it, pull up some normal saline to clear your line. Do as many times as needed, but give him a break in between. And hold down that suctioning for no more than 15 seconds. On your mannequin, it might be a little hard to get it down in there. And remember to swirl it on the way out. And then clear your line.
And then when you are done, you're going to roll it and curl it, and then take it apart and roll it into your glove and discard. You're going to re-give Mr. Jones a couple more breaths if needed.
So make sure you have that pulse ox and you're monitoring how they did. How are you feeling? Are you breathing okay? Make sure he doesn't need suctioned anymore. You have your suction close by in case he needs his mouth suctioned out. Make sure you give him his call light. Let me know if you need anything else. With our checkoff, we're going to do trach suctioning and trach care in one. We're going to do 2 separate videos so they're not too long so you can reference them.